To welcome you to today's press conference. I'm Diane Mihalik. I am Munson Healthcare's Chief Marketing and Corporate Communications Officer. Joining me today will be several representatives from local area health departments. Next slide, please. Which includes Grand Traverse County Health Department, the Benzie-Leelanau District Health Department, Health Department of Northwest Michigan, the District Health Department number 10, and Northwest Michigan Health Services. Our speakers today will begin with some joint statements, and after that we will have a Q&A session to answer any of the questions you have. So it's my pleasure to first introduce Dr. Christine Nefsey, who is Munson Healthcare's Chief Medical Officer. Dr. Nefsey?
Thank you, Diane. So we're going to start just looking at our numbers. We are doing this at the hospital on a daily basis, but for purposes here, every week. And as you can see, while our numbers do continue to increase, that rate of increase is significantly down from what it was in the past. So in our region, where you can see those counties highlighted here, we currently have cumulatively 19,041 cases, and our deaths are at 393. For the state of Michigan, we're over 500,000 cases and over 12,000 deaths. If you will look a little bit further down, you can see here that we have both the confirmed as well as probable. So our cumulative cases over the last 14 days for our cases per 100,000 is down to 379, which is a marked improvement from where we were last week. Next slide, please. This is the breakout for our Munson Healthcare hospitals and our number of COVID positive inpatients. You can see we are at 46. And while that number is significantly higher than the numbers we were seeing in the spring, it is much lower than what we have seen the past 2 to 4 weeks. So again, a good improvement in our numbers there. Next slide. This just shows you the uptick we saw towards the end of October, and now you can see that trend line is going down. We are hoping that we will continue to see a downward trend after the Christmas holiday, but we will certainly keep you updated on that. Next slide. So let's talk about the vaccine. We are very excited to have started our vaccine clinics around our Munson Healthcare regions. You can see here the total for how many have been given at each of our hospitals. So up to 2,717 at Munson Medical Center, which is our largest hospital. But you can see here that we have given a good number of vaccines across the region. Some of our smaller hospitals waiting for the Moderna vaccine opened up a little bit later. But we're very excited to be able to provide those vaccines to our healthcare providers. Next slide. So as of 8 a.m. today, we have given 3,693 vaccines to our healthcare team. 3,464 of those were Pfizer and 229 of those were Moderna. And again, that is because we received the Pfizer vaccine before we did receive the Moderna. We currently have almost 5,000 of our employees, credentialed providers, and contracted staff that work within our 4 walls of one of our entities, either vaccinated or scheduled, and that is roughly half of our eligible folks. Next slide. So we are really in a good place as far as the receipt of vaccine. You can see here the numbers of the Pfizer as well as the Moderna doses that we have received. We are expecting more shipments of both either today or later on this week. Next slide. We have centralized our vaccine scheduling center. So we do, when people call to schedule their vaccine, require that they do both their initial and their second dose. So we have centralized that. The people running that schedule center have received over 5,000 calls since opening. And again, we have scheduled and opened up that opportunity to all of our healthcare team. We started with our patient-facing employees, those that are at higher risk for exposure to COVID-19, and our credentialed providers. And since then, we have opened it up to all of our staff members, again, including our contracted workers. We should not have any issues with our phone lines or people getting through to schedule that. So that's been running very smoothly. Next slide. And as with most things, this takes a village, a lot of really amazing work from a lot of different departments to get this running. So we would really like to thank, on behalf of Matt Willey, the president of Munson Medical Center, as well as the entire Munson Healthcare team, our folks in continuous improvement, in NEMSA, pharmacy, employee health, our community health providers, our ambulatory care folks, human resources, facilities, our environmental services, food and nutrition, corporate communications, IT. So many people came together, taking on some additional work than their normal to ensure that we got good delivery, storage, and distribution of the vaccine across the entire Munson Healthcare system. So really grateful to this team who's done a really wonderful job managing this resource and getting it out to our Munson Healthcare family. Next slide. So a lot of questions on what's happening. And again, we keep saying that the one stable piece in this is change. So we are still in our Tier 1A, which is all of our healthcare personnel and our long-term care residents and staff. These are, again, the priority levels that have been put forth both by the CDC as well as by the Michigan Department of Health and Human Services. Our next tier will be the essential workers, and that has been fairly broadly defined as people essential to basically our society running well, who can't very well social distance. So those in our education sector, food and agriculture, utilities, police, firefighters, correction officers, those kinds of workers, as well as adults that are 75 years of age and older. We do get a lot of questions about this, what this will look like. When we are ready to move to that next tier B, we will absolutely get information out on our website as well as through various media sites to get that information out to both those workers as well as those community members that are 75 years of age and older. There was an adjustment to the Tier 1C. If you'll go to the next slide, it has changed a little bit. It had been just people age 65 years and older, and they did add people age 16 and older that have underlying medical conditions. So again, that is a slight addition or expansion of that Tier 1C. It does also include other essential workers, people in transportation and logistics, construction, IT, public safety law. So a little bit of a broader tier for 1C before we get to the next tier, which would be the general population. Next slide. Again, just some updated recommendations that we have brought out before, but some of these things do get slightly modified. If you have received convalescent plasma or you have received monoclonal antibodies, there is a recommendation that you wait 90 days between either receiving that plasma or the antibody before getting the vaccine. For those people who have a positive test for COVID-19 or even suspect that they had it, you can still receive the vaccine at any time as long as you are not acutely ill. So we are screening everybody that comes in to receive the vaccine, the same as we are screening anybody that comes into one of our hospitals and clinics. So as long as you are not acutely ill, if you have had COVID-19, you can get your vaccine at any time. The only other recommendation that we make is if you've received another vaccine, so say you waited till recently to get your flu vaccine or any other one, we would recommend that you wait 2 weeks between receiving any other vaccine and the COVID-19 vaccine. Next. And again, until we reach that point of herd immunity, which is between 70 and 80% of our population being vaccinated, it is still important that we don't let our guard down, that we continue social distancing, we continue to mask when we go out in public areas, and that we wash our hands frequently. Next slide. The other thing that I do want to make the point is that Munson Healthcare hospitals and clinics are open and safe. Please do not hesitate if you have an emergency to seek care when you need it. Ensure that when you are seeing your physician that you call for preventive screenings and appointments. Many of those can be done by video, but some cannot. So make sure that you call and coordinate with your office, your physician's office, before coming in. But if you do need to be seen, please don't hesitate. We have plenty of PPE, our supply levels are good, and we don't want anybody to wait and risk getting more ill by putting off care that they could receive today. Next slide. So I will now pass it off to Mike Leahy of the Grand Traverse County Health Department.
All right. Thank you, Dr. Nefsi, for touching on a few of those key points as well. So thank you again for the opportunity to provide some brief updates on our focused vaccine distribution plan out of Grand Traverse County Health Department. On December 18th, our county health department began vaccinating phase 1A, priority subgroup 1, EMS and first responders. Our vaccination teams have since begun to vaccinate priority subgroup 2, long-term care and assisted living facilities that we found were not covered within some of the existing pharmacy contracts. Simultaneously, our teams have begun to stand up and operationalize our plans to begin deploying vaccine to priority group 3, that is healthcare providers outside of the hospital systems. The size and scope of this priority group is expansive, and our teams are working closely with our partner health departments, as well as points of contacts and representatives of existing and new partnerships in the community that represent these practices and providers, so that we can begin an efficient distribution to these providers, to these healthcare providers outside of the hospital system. This is going to take some time through the month of January, and our health departments are currently deploying additional information gathering, as well as some more advanced scheduling components within these groups to ensure that we capture all that fall within this prioritization. It's really going to take a village, like Dr. Nefsi had made mention, just due to the expansiveness and us not wanting to miss any of those that have been reaching out to our departments, asking where they fall into these groups. That information is going to be distributed in a phased approach when we get to those prioritization groups. Additionally, as Dr. Nefsi noted, we have very pointed subgroups that are actively planning for phase 1B vaccine distribution, and how that will eventually take shape with the mass vaccination processes within the communities. Further information that Dr. Nefsi had noted on our phased and tiered approaches can be seen and viewed on those links on our websites provided. Oh, I think Diane. Yep.
I have to remember to unmute. Sorry about that. I just wanted to say thank you, Michael, for that perspective from Grand Traverse County Health Department. We appreciate you being here today. And Michael will be available for questions after the other speakers make their statements. So now it's my pleasure to introduce Lisa Peacock, who is representing the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. Lisa?
Thank you, Diane. Hello, everyone. Thank you for joining us today. I also thank Mike and Dr. Nefsi for those great updates. We are also seeing those similar trends of decreasing pandemic risk indicators, which is great. We know that the holidays have been difficult, and the restrictions that we are living under right now are difficult for people, but I believe that we are seeing some great improvement, and we are on track for for important things to change, like kids going back to school. So I would love to give you an update on our distribution plan as well. We also began vaccinating on December 18th. We had a goal at both health departments to begin vaccinating within 24 to 48 hours of receiving our first allocations of vaccine, which we were able to accomplish. And our ongoing goal is just continuous planning and implementation. As we are vaccinating the current groups, we are continuously planning for the next groups. And so we are finishing up our EMS staff, our medical first responders, our public health staff, as well as those unmatched congregate living facilities, those who did not sign up with a pharmacy to receive their vaccine for staff and residents. We have started outreach to other healthcare workers, and on the top of that priority group are dentists, those who perform endoscopy like surgery centers, home health workers, and other outpatient providers. We're also getting to some of the corners of our counties that are difficult to get to, like Beaver Island. We have a team over on Beaver Island today vaccinating their healthcare staff and EMS staff. We have launched an electronic form at both health departments, which is a survey that's available for employers and employees to be able to fill out to indicate their interest and help us gather numbers and plan for the next group that will be vaccinating. It will allow us to initiate contact with them when we are ready to schedule those priority groups. So we really want healthcare workers in 1A who are not affiliated with the hospital that need their vaccination to visit our websites and fill out that form so that we know how to contact them to get them scheduled. People in 1B can also start filling out that form if they're part of that critical infrastructure employment. And we will get that information compiled into a spreadsheet that we'll use for targeted outreach when it's time to start scheduling those employees. We have a great partnership between our health departments, our Northern Michigan Emergency Preparedness Team, and that partnership is in full swing. We meet several times a week with both hospital and other health department partners to make sure that we're staying on task with our messaging and consistent in our approach to the vaccination plan. And we just want everyone to continue to be vigilant while we are implementing this plan. It will take a while. There are lots of people in our communities that need the vaccine, but we are committed to keeping our community safe and working toward that goal of vaccinating many, many of our community members. So I will stop there.
Great, thank you, Lisa. Really appreciate the update. And if you would stick around for at the end for the Q&A session, we'd appreciate it as well. Next, representing District Health Department number 10, it's my pleasure to introduce Jennifer Morse, who is the Medical Director of District Health Department number 10. Dr. Morse?
Thanks for having me today. So we have similar stories as the previous health departments. We have at our health department received our Moderna vaccine shipment from the state, and the Grand Traverse Health Department did allocate us some of their Pfizer vaccine as well. We have been vaccinating our phase 1A priority group, primarily the first tier. We have vaccinated some of our frontline staff, those that would be vaccinating others. We have vaccinated some of the long-term care facility residents that have fallen through the cracks of the pharmacy plan. We are also vaccinating our community EMS workers. We have continued to vaccinate through this week and have vaccinated, as you can see, numerous individuals throughout our district, and we continue to do so. Again, we're focusing on phase 1A, primarily 1A tier 1, which is the EMS and other medical first responders in our community. We, as Lisa had mentioned, have a similar survey on our website. It's at dhdten.org/COVID-19-vaccine that anyone in the phase 1A priority group can complete the survey if they have not been vaccinated and want to make sure that they get on our list to be vaccinated. I recognize on our slide we also don't have a contact email or phone number. If there's any questions, we have a website, or sorry, an email that's just covid@dhdten.org. If there's any general questions or concerns, if anyone would like to contact us. We will continue to work through the tiers as we are able, depending on our vaccine allotment and as the phases may change over time. We'll just continue to be flexible. So I believe that's all I have for District 10 at this time.
Great, thank you, Dr. Morse.
Yep.
Appreciate the update. And now it's my pleasure to introduce a representative from Northwest Michigan Health Services. And originally, Heidi Britton was going to join us. At the last minute, we had a change, and it's now going to be Gwen Williams, the Chief Development Officer. Gwen, are you there?
I am. Thank you so much for having me. Sorry about the last minute change, little technical difficulties there for Heidi. So Northwest Michigan Health Services is a federally qualified health center, and we're serving northwestern counties from Traverse City all the way down to Shelby. We are receiving the vaccine this week for our healthcare workers, and we are also gearing up to be able to serve the most vulnerable folks with getting vaccine out into the community. What you're seeing on there is a picture of one of our mobile health clinics that has arrived, and we're getting it kitted out and fitted up so that we can hit the road and be able to really meet the needs of those really vulnerable, especially in the rural communities where it may be difficult for them to get to us for the vaccine. So we are just gearing up and getting ready and vaccinating our own staff right now.
Great, thank you so much, Gwen. Appreciate you being here today. Now I would like to invite all of our speakers to turn their cameras on, and we'll begin our Q&A session. And I'm going to start with Gwen. A question about the mobile unit that you just showed on that slide there. Are you planning to have a way where people can sign up to be vaccinated through that mobile vaccination clinic, or is this going to be something where, you know, kind of like we saw with the with some of the COVID testing, where you could drive up? Are you going to need an appointment or not?
Oh, that's a great question. And we're a little early in the game to figure that out yet, because we haven't received our vaccine and we're still in that early priority group. So we're not yet at the point where we're spreading it out into the community, but we've learned a lot of lessons with what we've done with COVID testing, bringing that out to migrant camps, agricultural communities, doing mass testing for that, doing curbside testing for that, and also what we've implemented with flu vaccines, where we've taken that out into the community. So we plan to use all of those methods to be able to, you know, bring the COVID vaccine out into the communities as well to reach those vulnerable folks. We have several ways of doing that. For some of the mass events, people just show up. For others, we like our curbside, what we've done so far with curbside testing, people can call and get appointments. And we even had for a while an opportunity for people to just schedule through our website for COVID testing. We expect to use all of those technologies as soon as the vaccine is available, and we can push the button on that.
Great, thank you so much. This next question I'm going to ask of Michael. And we're getting a lot of questions about, there's several questions that have come in already about more of the general population. You know, Dr. Nefsi had mentioned that there is, they recently added to one of the tiers of some people with 16 years of age with underlying medical conditions. But Michael, some people are asking, when might the vaccine be available to those under the age of 16? And also, is there a timeline for when 1B and 1C can start getting their vaccine? So maybe I'll just have you speak to that, and then I'll have the rest of the panelists make some comments as well.
Yeah, absolutely. I could start, and a few can assist on that. But, you know, the one thing is there is no actual timeline or phases that we abide by with the deployment of the vaccine. It's as we progress through these tiered approaches, and we feel that we've accomplished, you know, a vast majority of that tier, will we open up these additional phases. So it's likely, and is already occurring, that we're vaccinating some of these groups simultaneously. On the tail end of EMS, we started deploying to some of these congregate care settings, and that will happen while we have teams in the field doing some of those sites and opening up some of these healthcare providers. So the phase 1A, tier 3, it's a large phase when you really take a look at how many providers are in that phase, from medical providers at a physician's office to dental practices to you know, even some of the things that you may not think of when you see that that are included in that group. So it's hard to give an actual timeline as to when we will be into that next phase, but we've already begun, as all of our partner health departments in the hospital system, scheduling, doing some of the vaccination already for healthcare providers. So, you know, as we enter into the healthcare provider the next few days, our teams will be doing those vaccinations, as a few of us in those plannings at those health departments will thus be looking ahead at how we start scheduling and getting that information out to the public. So really the methodical deployment of our vaccine with the first few tiers has really provided us an opportunity to exercise how we can reach out and then develop those buckets and then begin the scheduling process. So it was really an advantage to us to exercise some of those things that we had already put in place prior to even receiving the vaccine, so that when we get to these larger expansive tiers, our methods are proven through our practices.
Great, thank you very much. I'm not sure if anyone else wants to make any comments on that, but I think that summed it up very well, where, you know, some of this is still unknown, and the timelines of things are probably going to ebb and flow as we learn more about distributions. If there's anyone else that would like to make a comment on that, I'll leave it open right now for you to do so.
Diane, I can weigh in on the age piece. So
Sure.
the initial studies that were done on the Pfizer and Moderna vaccine were not done in children. So the FDA has recommended that the Pfizer vaccine can be given to ages 16 and up, and Moderna is 18 and up. So until further studies are done right now, children under the age of 16 would not be included in our vaccine programs.
Great, thank you. That's a really important clarification. And Dr. Morse, did you also have a comment on that?
Yeah, I was just going to clarify about the question about 16 for that exact reason.
Okay, great. Thank you very much. Our next question is for Dr. Nefsi. It is related to the state's vaccine dashboard, and may not be exactly what some of the numbers are that we reported today. Is there a difference between distribution and administration of the vaccines?
Yes, there's a big difference between the two. So obviously the vaccine that we're getting distributed, some is being stored and some is being given. I think we've spoken previously about sort of the logistics of these vaccines and the storage capabilities and that kind of thing. I'd say the other thing is, you know, we are required when we give these vaccines to update MICR, which is the state database that tracks the vaccines, and we have 24 hours to do that. So our data is kind of real time. We're doing it a couple of times a day. So the data that we are giving today, for example, is updated from this morning. But those results won't be necessarily added into MICR until later on today, or even updated until the next day. So because there's that time lag between the two, I'm guessing the state is using the MICR data to show how many people have been vaccinated. We're showing our own data from the clinics directly. So there will be a little bit of lag time between the two.
Great, thank you, Dr. Nefsi. This next question, I'm going to ask Lisa Peacock to comment on. You had mentioned in your slides, you know, it's been, these have been difficult times as a lot of businesses have been either shut down or, you know, having to adjust their operations. We did have a question come in about employers, and how should what are the steps that employers should be taking right now in order to make sure that their employees, if they fit into that critical infrastructure, get to the top of the list? And I assume it's kind of using this type of information in press conferences and using the resources available on websites. But if you just speak to that for a moment, I'd appreciate it.
Sure, absolutely. We're using a combination of widespread public information sharing as well as targeted outreach. So I mentioned that we have launched a survey that's available for employers or employees who identify into either Group 1A or 1B at this point to fill out. And those should be easily accessible on our websites. We're working on making them kind of front and center so people can see them right away when they go to our websites, and those links are listed on my slide. But that is a great way for us to know that you're out there and what sector you feel that you fall into. And what we're doing is just populating a big spreadsheet with that information. We ask for a point of contact. And so when it's time to bring those people in for their vaccination appointments, what we'll do is contact the point of contact and say, it's time for your employees to call and schedule. They can call this number. And that's how it's working, at least at my health department. Departments may have a similar process as well.
Great, thank you. Does anyone else want to comment on their process for keeping that tier of employers in the loop? All right, well, Dr. Morse?
I was just going to say it's similar. I cover 2 other health departments as well, and some are using surveys. I know District 10 sends out regular Gov delivery emails to multiple different people. So it's similar.
Great, thank you. This next question is for Dr. Nefsi. You had mentioned in some of your numbers you reported that our hospitalization numbers are seeing a downward trend. There has been a lot of speculation in national news that we will be kind of gearing for another surge. Do you expect that to happen? And if so, approximately when would we see another surge?
It's a great question. I think we have absolutely benefited by some of the parameters that our state health department has put into place. I think that has definitely helped us flatten the curve a bit. And as everybody knows, those are still in place. We had, I think, good adherence to the recommendations around Thanksgiving, and we're hoping that the same holds true and that we continue at kind of this manageable level. It's really hard to know, what will happen and whether people followed those guidelines or not for the holidays. So, like I said, we continue to track this on a daily basis, looking at some leading measures as well to see if we can kind of predict the hospitalization piece of it. We will just continue to monitor that. And certainly if we start to see the trend line go in a different direction, we will put things in place to prepare for an increase in the number of hospitalizations that we have.
Great, thank you, Dr. Nefsi. I have a few more questions for you as well. You had mentioned with the change in in the tiers that now people 16 and over with underlying medical conditions were added to that tier. Can you explain what qualifies as an underlying medical condition?
Yeah, I think we're pretty familiar with the comorbidities that make the seriousness of getting a COVID-19 infection worse. So, people that have kidney disease, as an example, people that have diabetes, asthma, those are the things for the younger population that would be, part of the concern. Certainly with our older population, obesity, heart disease, high blood pressure, congestive heart failure, COPD, any chronic lung condition. There are a lot of different comorbidities that have a poorer outcome predicted with contracting SARS-CoV-2 and developing COVID-19. So those are likely to be the ones that we will be tracking and making the recommendation for an earlier vaccine.
Great, thank you. And can you also clarify, should pregnant women receive the vaccination or not?
Yeah, that's a really good question. That is another population, pregnant and lactating women that weren't studied well with the initial phase 3 trials for these vaccines. So the current recommendation is really to make a decision jointly with your physician about whether the risk to you outweighs or the benefit to you potentially outweighs the risk. So that is a personal decision that we would invite anybody that is in one of those categories to make with their provider.
Great, thank you, Dr. Nessie. This next question is for Michael. The question is, are you concerned about future supplies of the vaccination, as each person has to get 2 doses, and as you're rolling out your first doses right now, any concerns about the supply chain or actually getting those second doses in?
Yeah, I would say at this time, we worked diligently around the 15th, 16th, 17th of December to get those first shipments in for those that received Pfizer. And since then, we've had daily correspondence with our state health department in that ordering process. And at this time, I have no concerns at this moment for future shipments in those second doses and the receipt at our local health department for deployment. So at this time, things are entering the building as they should be and being prepared for clinics as scheduled. So I can also defer to any of the other local health departments if they have any comment.
Not sure if anyone else wants to comment on that, but I would assume that your answers would be similar to Michael. So thanks for covering that, Michael. We do have a question, and I'm going to start with Dr. Morse and then maybe ask the others to comment on this. But within the different tiers or classifications, is there anything, if a person feels that or thinks that their particular situation, whether at work or in the community, makes them at higher risk than some of their peers in their specific profession, is there room to accommodate or make special accommodations for people, or are we truly kind of sticking to the book and following the guidelines that have been given to us?
That is a really tough one. And, everyone's situation is unique, but if we took everyone's situation into consideration, we'd never have time to vaccinate people because we'd be considering every situation separately. For the fairness and ethical distribution of vaccines, we really need to follow the book as much as possible, just because we need to get the vaccine out into people. Certainly, we may have one person or people that may argue that their situation is different than someone else. But if we, bend in one area, we're going to have to bend in another and another and another. And again, we'll spend our whole day deliberating each individual situation rather than giving out vaccine. And so I feel that we've had huge committees have these deliberations so that we don't need to do that on an individual basis. And again, we'll have people that may have had very legitimate reasons to get vaccinated a week or two before someone else. However, for the sake of society as a whole, we really need to follow the guidelines and use our time as best served and just continue vaccinating according to that plan.
Great, thank you, Dr. Morse. And on a related question for Dr. Nefsi, we've seen some reports across the country about delays in actually administering vaccination doses and concerns around whether or not rural communities are able to get the vaccines out quickly. And so can you just please comment on how do you think Munson Healthcare has done to date compared to other parts of the country or the state, and whether or not you think that that will continue?
Yeah, it's a good question, and certainly there are some news stories out there about the differences between a rural community and a more urban one. And so absolutely we are more spread out We have single health departments for multiple counties. We have, single hospitals that serve many towns and geographic areas. That being said, while we do have maybe a little bit of driving and distribution to do around our region, I think that, we have worked very well with the state. We are in at least weekly contact with the folks from the governor's office, as well as the Michigan Department of Health and Human Services and our regional health departments. And I think that collaboration has really served our community well. I haven't seen any issues with the distribution. I think it was Lisa that talked about being out on Beaver Island today. I mean, certainly we have some unique situations that somebody in Detroit or Chicago would not have to worry about, but we also live here and work here all the time and are used to dealing with some of those regional considerations. And I think that together we have done a really awesome job at meeting the needs of our community, and will continue to do so.
Great, thank you. And Lisa, do you want to comment on that as well?
Sure, I would be happy. It never fails. The dog barks every time I start to talk. I just wanted to say that we are committed to consistency and partnership, and this is definitely not the only time that we talk. We are in conversations nearly every day with our hospital and health department and other community agency partners. And so that regular communication has served us well throughout the pandemic and during normal times, and I know that it will continue to serve us well through this.
Great, thank you, Lisa. And that leads directly, I was going to have Gwen also comment on that question. And we actually just had another question come in with some very similar sentiment, which is, living in a small rural area, will we be able to get the vaccine at a local clinic, or will we have to travel? And I know that you mentioned you were going to have some mobile vaccine clinics. So Gwen, can you comment on that, please?
Right, yeah, I think we showed on the slide our mobile medical unit there, that we have 2 of those, and we've learned a lot about reaching out into the community, into different areas throughout COVID, and we plan to use all of those methods as we're delivering vaccine. But my understanding is it's an all hands on deck situation, so other medical providers as well may be vaccinating their own patients. We certainly are looking for opportunities to get out into the community and to do that alongside the health department and all other partners.
Great, thank you. This next question is for Dr. Nefsi, and it's related to the current studies of the current vaccine doses that are available to us right now. It's a lengthy question, but I'll try to give you the cliff notes, which is basically, do we expect additional studies to continue? Will we have better data by spring, when the general population will be most likely more able to get vaccinated, and how will we get that information out to people?
So yes and yes. The studies do continue, and we do expect to get more data as things move on. For those who haven't yet been vaccinated, and I haven't either, but I am familiar with the process. There is quite a bit of education that goes on, as well as some reporting much more robustly than we would typically do for a vaccine, where people have a direct link to the manufacturers to report anything from side effects or anything like that. So there is a lot of data gathering going on by both Pfizer and Moderna. And so we do expect those studies to continue as we vaccinate more people and to get better information, not only more broadly, but specifically to people like pregnant patients or those that are lactating, as an example.
Great, thank you, Dr. Nefsi. One more question for you. Now that you've reported that we have about 50% of Munson Healthcare workers and contract employees and providers vaccinated, have you seen any change in the side effects that you mentioned the last time we had a press conference last week, which was basically I remember you reporting that we weren't really seeing many side effects at all.
That is correct. We still continue to see very mild side effects, if any. The ones that I've heard the most frequent are a little bit of a sore arm, which I think most people can get with even the flu vaccine, or certainly in my military experience, things like yellow fever can give you a really sore arm. So we are just hearing the normal, very mild side effects so far. We do, in some of my reading, have heard that the second dose may cause more significant side effects. So as we approach that time frame where many of our healthcare providers will be getting their second dose, we will certainly continue to monitor and track that. But thus far, we've seen very mild side effects from the reports we've seen, if any.
Great, thank you very much. And unfortunately, we are out of time today. We appreciate all the questions we've received, and if we did not get to your question today, we will be taking a look at all the questions that have come in and updating the FAQ section of the munsonhealthcare.org website. We will also be posting this recording to our website, and I'll modify a couple of the slides I saw that had some information that was cut off to make sure that everyone is fully aware of all the different websites and phone numbers that they can call through the local health departments and Northwest Michigan Health Services. So thank you to all of our panelists today for joining us. We will try to have this group back in about 2 weeks to provide another update. But Munson Healthcare will be doing a press conference next week as well to give an update on our vaccination numbers. So thank you, everyone, and I hope you have a healthy and safe new year.
Thank you.
Thank you.
Thank you, everyone.